hopefully in the show we'll be able to share with the listeners an idea of maybe they can visualize what you do in your practice, because I had the great fortune to, of course, hearing about you and then coming for a treatment. I don't know if you call it that.
It's
an appointment. Yeah. And
it's an experience, actually.
An experience. It really was. And, and I was really blown away just by how focused you are and how good you are at what you do and how quickly you can, operate. But so I want, to share with the listeners, sort of maybe visualize what it is that you do. But before that, you have what you call a 4-step protocol. Can you explain that to us?
Well, after many years of muscle testing, I realized that in 20 years of practice, and I've had a lot of people that I've helped over the years, and I came to this conclusion that the 4 major things that really need to be addressed, and I call it, first you have to correct the structure, and the structure being the foundation of who we are. You wake up in the morning and you don't wake up and say, oh, my amino acids are sore today, oh, my essential fatty acids are killing me. You wake up and you feel your body. And it's the structure that we interact with in the world. So the most important thing in the beginning is to correct the structure. And in order to keep the structure corrected, there's certain things you have to address. One of them is, the second point is, I call it point the mind. Having studied NLP and having been in doing a lot of schooling towards how the mind works and understanding quantum physics, and of course anyone who's seen the bleep understands that the mind is extremely important. And pointing the mind is really refocusing the mind in the way it needs to be to make the person heal, to allow the healing to take place. The third part of my protocol is to balance the chemistry. And that would mean balance the nutrition as well as avoid toxins. And there's a lot of things people can do for that, but specifically we can also muscle test to eliminate that and eliminate the things you should eliminate and take the things you should take. And the last part of it is, I call it move the energy. And sometimes you're using a meridian therapy, sometimes there's just getting the body moving. But if you can move the energy after doing all of that, after supporting the chemistry and balancing it, the structural corrections hold, and that leads to wellness. That's how you optimize your health. So it's something that I've come to. There's a lot of things that you can do. I have a really large toolbox of skills I've developed over the years to get people into that place. But that's the protocol. It's basically very simple and yet detailed.
Okay. Well, when you talk about correct the structure, is it, for example, are you talking about correcting the structure, I don't know if it's the skeletal structure or the alignment of the body? Because if that is not done, number one, then things are going to be pinched or in the wrong place, or a nerve could be pinched here.
It's the simple concept that the chiropractors used to say is that if your spine's out of place, it's like having someone standing on the garden hose and your garden doesn't get enough water. Far more accurate is the actual concept now that they're understanding that it's the information that comes into the nervous system is altered. And in some ways you could say like the gain is turned up in some areas and the gain is turned down. So when I talk about correcting the structure, I'm talking about not just aligning the bones, but balancing the muscles, balancing the pull of the muscles, balancing the fascia, which is the sleeve that everything slides in. From the top of your head to the tips of your toes, the fascia covers every muscle, every organ. It invests between the layers of the muscle, and it's continuous all the way down to the very cell membranes. We're talking about balancing the ligaments and the tendons and how they work. It's the cranial bones, even the teeth. Every tooth relates to a certain organ and a structure as well. So I can tell you an example. I've had patients come in and they have a chronic, for example, a chronic low back, and they've been to the other chiropractors. They've been everywhere. They've been getting it adjusted and say, okay, it won't hold. Why doesn't it hold? Further evaluation, you find out all of a sudden that a muscle in the low back, in the pelvis called the piriformis muscle doesn't hold. Why won't it hold? Because they've had an extraction of the tooth that is at the same reflex of where that muscle is. So you have to address those factors. And if you don't correct all of the things involved and then support it with some of the chemical balancing, the correction doesn't hold, and that's the thing that reoccurs. That's the difference between being a professional applied kinesiologist and just the standard approach of what Einstein says, if definition of insanity, do it over and over again, expect the same thing and expect a different result. So you've got to take the approach, what am I missing? And that's when you start looking at all the possibilities.
Talk a little bit more about point the mind. Is that focus? What is that?
Point the mind is really, it's very simple. It is focus. It's distracting the mind from the problem. Because from quantum physics, we know that you will create what you focus on. And if all you think about is your sore left foot, then guess what? The focus is on the left foot, and you're going to have that sore left foot, and it's never going to go away. Now, there's a lot of skills that I've learned, things NLP, and I've got a lot of tools that way, but pointing the mind means getting the focus off of the left foot and onto something that is perhaps even completely different. And there are ways to do that. There's a lot of meridian techniques and NLP techniques and just focus and meditation techniques. To point the mind means to point it in the different direction because the problem has been the focus that it's been.
Okay, and then there's also the Three Stooges techniques, but...
Well, poke them in the eye and get their focus off their ear, right?
I'm normal. My husband always does that. So then you have balance the chemistry and move the energy. Let's just talk a little bit more about the last two steps before we move on.
Balancing the chemistry. Well, there's a couple things to consider here. When you talk about organs, muscles move bones, right? Ligaments stop bones from going too far. Muscles move bones. Every muscle relates to a gland or organ. And every organ has certain functions, but within those functions there are certain what we call rate-limiting steps. There'll be a certain nutrient or a certain chemical compound that is like the kingpin in terms of controlling the rate of how that organ can function. If you have a deficiency in one of those substances, then that organ isn't going to function perfectly. So it will draw energy from other circuits. And it will allow those muscles not to function properly, which then doesn't allow the bones to sit properly, which then you have a whole host of problems that come from that. So you can correct the structure, you can point the mind, but in this situation you need to balance the chemistry. And I can tell you, so many examples, but just the other day I was treating somebody who had a chronic lower neck thing that kept coming back, and we find out that liver was involved through the liver meridian, and they had some nutritional things they needed to fix for the liver to support the liver so the liver didn't continually have to draw energy from other circuits, and thus that stops the neck pain, or makes it hold better at least.
And move the energy.
And move the energy. Well, meridian therapy, you can do yoga, you can do Tai Chi, you can just get out and move your body. There's lots of ways to do that. There's as many ways as there are people. And everyone's got their own way, but the biggest factor is when I say move the energy, you want to move the energy, move your body. Period. It's like people saying, can I be healthy without exercising? Not really. It's not going to happen. I mean, there's plenty of studies that have shown that in many different directions. But to move the energy, for some people, they got to go walk down by the beach by the ionizing forces of the water. Some people like to sit in the rainstorm. It varies, but there's a lot of ways of moving the energy. But if you don't, if you hear this and you hear my voice and you never come to see a practitioner that does what I do, at least get out and move your body.